Êtes-vous un propriétaire d'entreprise qui fait partie de notre communauté haïtienne dynamique en Floride et dans les Caraïbes? Si tel est le cas, vous avez probablement remarqué à quel point la vidéo devient importante en matière de marketing, de vente et de capture de souvenirs. En fait, l'utilisation de la vidéo est récemment devenue une attente des clients dans le monde entier. Et que vous le sachiez ou non, vous avez une histoire inspirante mais non contée. Votre point de vue unique sur le travail, la vie et tout le reste. Mais avec tout le monde qui crée du contenu en ligne maintenant, il est presque impossible de se démarquer. C'est pourquoi vous avez besoin de Lens Magic de Cajou TV, des services de production vidéo auxquels vous pouvez faire confiance. Des courts et longs films, des émissions de télévision aux événements en direct, au contenu des médias sociaux, aux occasions spéciales, quels que soient vos besoins vidéo, aucun projet n'est trop grand ou petit. Lens Magic utilise uniquement les dernières technologies et équipements pour ravir nos clients à chaque fois. Notre excellente réputation au sein de la communauté est basée sur d'innombrables projets réussis, réalisés au cours des 20 dernières années dans toute la Floride, Haïti et les Caraïbes. Et en plus, nos forfaits flexibles garantissent aux clients la meilleure qualité à des prix abordables. Alors qu'est-ce que vous attendez? Visitez cajoutv.tv et découvrez comment vous pouvez utiliser la vidéo pour mieux raconter vos histoires.
This is Dr. Blanc for Caring Hearts Talk Show. I want to thank everyone for being a part of this show. And I want to thank everyone who've been watching from day one and who've always been supportive. So we want to thank you for joining us tonight. I like this saying that says sharing is caring. So if you are watching, we would like for you to share the link so that other people can benefit from the information we are about to share. I have tonight a special guest, a special friend who's I've known for over a decade. So she will be a special guest for tonight. We will be talking about wellness. We'll be talking about diet and nutrition and some products that have done great for her and also for myself. We'll take a short break and we'll be right back.
Caring Hearts Family Medical Center, un établissement moderne qui est dirigé par Dr. Jocelyne Blanc, Dr. Odiel Jean-Baptiste et Dr. Regina Jérôme. Caring Hearts déjà fait un pile palais de lit dans Belle Glade à West Palm Beach. Clinique là, équipée de plusieurs blocs opératoires ultra modernes avec des spécialistes professionnels qui d'ailleurs parlent anglais, créole et espagnol. Quand il s'agit de bail soins de santé, il y a un pile l'autre clinique qui existait. Différence qui gagnait, l'autre clinique qui travaille pour. Nous-mêmes dans Caring Hearts, nous prenons soin. Nous traitons chaque patient avec passion dans un cadre qui est propre et soigné. Caring Hearts prend plusieurs assurances médicales, telles que Humana, Medicaid, Medicare, Oscar, WellCare et un pilote encore. Caring Hearts Family Medical Center, c'est numéro 1 dans les affaires santé.
Welcome back, everyone. Welcome back, Cajou TV fans and also the fans of Caring Hearts Talk Show. The topic we will be talking about tonight, it's wellness. Wellness is a multi-billion-dollar industry. And their role is to bring awareness and it's also to bring health consciousness. So tonight, we have a special guest, as I mentioned before, who will be talking about wellness and beyond wellness. Her name is Christina Jemimez. She's a special friend. I will let her introduce herself to the community. Hi, Christina.
Hi, Dr. Blanc.
Welcome to the show.
Thank you so much. Thank you so much for everyone who's watching us today. I truly appreciate you. I am more than humble. I am ecstatic for you. This is like wild right now for me watching you in this scene. I feel so grateful.
Aww.
So grateful for what you're doing because it's something that is so needed in so many levels. This type of one-on-one conversations and just being human talking to other humans and letting them know how we feel about certain topics.
Beautiful, Christina, beautiful. So I know you personally.
Yes.
But the viewers do not know you.
No.
So I want you to tell them about yourself. What do you do and who is Christina Jemimez?
Well, beyond Dr. Blanc being my doctor for over a decade and just loving the doctors at your office, Caring Hearts is the best office ever. Dr. Reginald, Dr. Reginald is dear to me.
I know.
I just love him. Dr. Baptist, I can't leave him out. You guys make a phenomenal team.
Thank you.
Your office is so warming. I've always felt that it's been so personable, and it's so hard to find someone that you feel that you reach, you connect, and you get
Can relate.
and we can relate, right? And not only that, you're going to pay attention to my needs, and that's another thing that I love about you. I know you probably are not going to like what I'm saying, but you're not a holistic doctor.
No.
But I honestly feel you do have a holistic approach.
And I'm glad you mentioned that, Christina, because that's what we do at Caring Hearts. So we don't see you just as a patient, but we see you as a whole. We see the body, we see the mind, we see the soul. And I'm glad you mentioned that.
Yes. Because it's so important nowadays when you go to a doctor, you sit down for 5 minutes. And I know a lot of you can relate with this. You sit down for 5 minutes, you only get 5 words out. And what do you want? What is wrong with you? And here are all these medications you want to take. And there's a lot of people, I'm one of those people, I want to stay far as away from it because I know what certain medications can do to you. And I really like the more of a holistic approach, being careful with some of the things that we do to ourselves. I know you asked me what is my profession, so I'm going to tell you I'm a mother. I have 2 children, 2 young men, 21 and 15-year-old, and I'm a fiance to my fiance.
You can't leave him out.
I can't leave him out. He'll be watching this.
I know.
And soon to be married. My profession.
Congratulations.
Thank you. Thank you.
You're
I'm
welcome.
excited. I am a health insurance broker. It's been my profession for over 12 years. My insurance agency name is Evergreen Insurance. I love my job. I love my employer. It's a wonderful opportunity that I've had to grow with this agency and help so many people. In our agency, we do commercial. Personal lines, which includes homeowners and auto. In my field, it's healthcare, health insurance. My specialty is in employer benefits. I also do long-term disability, anything in the health, life insurance, individual, Medicare. The list is so long. I can keep going.
You can keep going.
I can keep going.
Sell yourself, honey.
I'm a jack of all trades. At least I try to be. And so that's my main profession. That's what I do. My second passion and what began as a hobby and now is my second job is I am a health and wellness consultant for Arbonne Network Company. I love it. It's brought so much awareness like you just brought to the table. I came across this company because I was in 2020 when all of this stuff that's happening in the world started. We were all looking for a way of healing ourselves and finding anything that can help make us better human beings from inside out. When I ran into this company, that's exactly what they were offering me. I can tell you a little bit about what the company is, and I'm going to read a few lines because I want to make sure that I'm very clear with the message that I'm sending. Arbonne is a health and wellness company with over 4 decades of history. We believe in a holistic approach to beauty, health, and well-being, focusing on the person as a whole from inside out, which is very important. We follow a very stringent ingredient policy resulting in clean nutrition, skincare, body care, hair care, and makeup products. Our product philosophy embraces the connection between a healthier mind, stronger body, and more beautiful skin. So that whole approach bought me immediately. I was like, okay, what is this? Where do I buy it? Where do I buy it? Where do I sign? Just send me a sample. It started back in March of last year. I started trying a product at a time. And then because I'm in sales, I naturally just grew on to, I have to share this with people. People need to know this is out there for them. And it's done so many wonderful things for me, and I know it has for you
For
too.
me as well,
So
yes.
today we're here to share it with you.
Absolutely, absolutely. I know we will be talking more about the company, but before we get into that, because I know we've talked about wellness and healthcare, right? But I don't think we would be doing our audience justice if we do not incorporate healthcare cost.
Yes.
So to your opinion, and I know healthcare costs is crazy with what's going on right now,
Yes.
but does our health affect healthcare cost?
Absolutely. That is a fantastic question. A lot of people don't understand the factors that take healthcare to this cost that we are now. It is out of control. Some of us, it's become another mortgage for some people just to afford healthcare. And I'm sure some of you at home can agree with that. What I can tell you, what the driven factors of the cost of healthcare have been chronic illnesses. Chronic illnesses are the ones who have driven the cost of healthcare. I'm going to read a passage to you from Yama's study point, where they did a medical study to determine what were the costs, where did it fall? Because we have in the industry, there's so many factors that take in place. So this is what they came up after their study. Diabetes as the medical condition responsible for the greatest increase in spending over the study period. The increased cost of diabetes alone was responsible for $44.4 billion of the $64 billion increase in cost to treat the disease. Did you hear that?
I heard that.
Cost to treat it.
To treat it. And I can relate. Diabetes, that's why not too long ago, couple weeks ago, we've had a show on pre-diabetes. The reason we focused on that is because we don't have to get to the point where you have to have diabetes. So if we tackle it while you have pre-diabetes, we don't have to get to that cost. And if you look at someone who has diabetes, it's very costly. The medicines are expensive, the supplies are expensive, and some people with diabetes, their eyes are affected, they become blind. Some of them become amputees due to complications. So it encompasses a lot of costs when it comes to diabetes. And this is not just diabetes. This is a list of chronic illnesses, and diabetes being one of them.
And it's crazy because a lot of people out right now that didn't know this information, probably because all we hear is cancer, right, Dr. Blanc? All we hear is cancer. Here we're
Besides
thinking,
COVID now.
Besides COVID, yes. We're thinking cancer is number one. No, it's diabetes, something that is controllable, something that we can prevent as human beings. It's the cost of the expensive the cost of insurance. I'm sorry. I'm going to read a couple more because I want you to understand some of the other factors that increase our health care. Lower back and neck pain is $57.2 billion. High blood pressure is $46.6 billion. High cholesterol, $41.9 billion. Depression, $30.8 billion. Osteoporosis, $29 billion. Bloodstream infections, $29 billion. Falls, $26 billion. Oral disease, $25.3 billion. Now, Dr. Blanc, out of all of those that I just read, all of these are preventable.
Preventable, yes.
All of them are preventable with a diet.
Correct. And I wanted to mention when it comes to lower back and neck pain, that was your second chronic illnesses. We've seen people who enter disability way before their age. So which means the whole system is affected. Our economy is affected because if I cannot reach the age of 65 to work, guess what? I become to the point where I'm disabled. The government has to take care of me, and productivity is not the same. And as a nation to grow, productivity must be a plus. So this really, when it comes to cost to healthcare, not only healthcare it's affected a whole lot of other stuff.
Life of a lot of things. That's where that whole beyond health is so important. Because it just triggers one thing after the other,
like a domino effect.
Like a domino effect. So in this scenario, what has done throughout the years, this study was in 2019. Okay, so now we know with COVID, we can only imagine where these numbers are, right? So this has caused for our insurance to go up with higher deductibles every year. Every time you look at your insurance, it goes higher deductible, higher maximum out of pocket, higher co-pays, right? Even though you have your basic coverage, like your preventive cover, because there's the ACA law that it has to be covered. There are certain stop losses that before we didn't have. Another major thing is pre-existing conditions are a thing of the past. So this is why we can have all of these things covered nowadays.
And thanks to the Affordable Care Act.
Correct.
So that's why we're able to, that they cannot discriminate against pre-existing conditions.
So now we have all these factors that are triggering the cost up and up and up, because obviously the illnesses haven't stopped. We're just facing more of this every single.
If anything, it's gotten worse.
It's gotten worse. Would you say that as a doctor that you're seeing
absolutely.
It's gotten worse. So with that in mind, now that the deductibles have gone high and the copays have gone high, now there's another problem that has happened. That's where the affordability is no longer there for some people to go to the doctors, because a lot of people, based on this survey from 2019, people are avoiding the needed medical care due to the concerns of the high deductibles and copays, because it's not affordable for them.
And sadly, sometimes they wait until it gets to the point it's too late.
Exactly.
And they go to the emergency room.
Exactly.
Rather than going to the doctor's office to do preventive care.
Preventive care.
They wait until it's too late. And this is reality.
It is the reality. I want to say in Latin America, because of the way the system works in Latin America, and I'm sure in Haiti probably works the same way, third world country, we're such a structure here in America where we have a doctor, we have a specialist. If my doctor or specialist is not available, we have urgent care, which is open 24 hours. So the way I describe an urgent care is a mini hospital, right? They cannot do surgeries, but they can treat something a little higher than a doctor. And then we have hospitals. I learned that in my country, I'm Colombian, everybody goes to the hospital. So I didn't understand that. I was like, what do you mean everybody goes to the hospital? Why aren't you going to your doctor? Well, that's the first point. They go to the hospital, then their issue to go to the doctor is backwards. For us here, we don't want to utilize the emergency room
as our primary care.
A lot of people, you hit it right on the head. A lot of people do not do the preventive care, do not come see you as an annual visit, do not follow up with their medications or take them on a timely manner. So then it gets to the point where you walk into a hospital, and walking into a hospital with insurance or without insurance, the minute you step in the hospital is $10,000. That's the magic number, is $10,000. And then it goes up. It goes up. So if we want to control, if we really want to control the cost of healthcare, we have to be mindful of what we're doing.
Absolutely.
We have to elevate our consciousness. We need to be responsible for us.
Yes, our health, our priority.
Our priority. We work so hard because we got to pay our phone. We got to pay our car. We got to do that. But we will not go see you first.
We will not.
We will not. Why?
Well, I think, Christina, you've raised important points. And I think we have to elaborate more, but we have to take a quick break, and we'll be right back. Kim Hart's Family Medical Centers has been in existence since 2014. We have 2 locations, 2135 South Congress Avenue, Suite 4A and B at Palm Springs, Florida, and also in Belle Glade at 371 South Main Street. Meet your medical team, Dr. Jocelyne Blanc,
Dr. Odiel Jean-Baptiste,
Dr. Reginald Jerome.
We take most major insurances and we offer a full range of services such as EKG, labs on site, allergy testing, and treatment. We also offer DOT, work, and school physicals. Visit our website at chfmedical.com and call us at 561-965-63. Welcome back. If you just join us, we're just talking about Beyond Wellness.
Yes.
And you've raised so many great points, Christina. And I want you to elaborate about self-awareness. We have to be more mindful of how we spend the money because at the end of the day, our children will be the one, I think, who would have, I think the economy or the costs would have the greatest
Suffer
impact
greatly.
on
Absolutely.
them.
I completely agree with you 100%. We need to awaken. We need to awake as human beings. We need to be in the present moment. And a lot of people forget about that because, again, like I was saying before, we're in the rush of life. Everything is a rush. Everything is a rush. We'll go work to pay the car, pay the house, pay everything, but we will not take care of our health care. But what happens when we crumble?
The whole family suffers.
The whole family. And then it goes back to, which you mentioned, people in disability early, loss of life early, families breaking apart.
Correct,
because the proper structure wasn't there. There wasn't life insurance to help pay the home, the mortgage, food, the burial. Some people struggle with that. So we as human beings need to be alert. We need to be responsible for us. We need to take action. I think a lot of the problems that we're suffering is we are so disconnected.
We are, and I've seen that before, and I've heard it, that nowadays we use our phone or tablet, or we're supposed to be more connected, but yet we are more disconnected than before.
More disconnected, and the scary part is that we're disconnected with us.
With ourselves, too.
With us. Our body speaks when we're in pain.
Yeah.
When we get scared, our heart starts beating fast. That's letting us know something, right? When we are stressed, automatically your head starts hurting and you start getting real bad, a strange headache. Now we know it's our blood pressure because that's the life that we live now. But we do not pay attention to it.
We ignore the signs.
We ignore it, right? And our bodies talk to us.
Oh, yes.
Talk to us. So that's why I say we have to elevate our consciousness. We have to be responsible for us. We need to start taking better care of ourselves because this insurance problem is only going to get worse. If we don't start being conscious of that, pretty soon only a certain category of people will have health care and will be able to afford it. Okay?
It shouldn't be a privilege.
It shouldn't be.
It shouldn't be.
It shouldn't
be. But unfortunately, and not everybody, even now, even with Affordable Care Act, not everybody can afford insurance.
That's correct. And not everybody falls in the gap to afford it because every year, they increase the limit of what you can make to qualify for the health care. So I believe this year the qualifications went up to $12,700. So you have to have a job, and that's the minimum that was allowed for you to come in to qualify for health care. So now what happens to the rest of the people that fall under that? Those are the rest of the people that fall in a gap where they don't qualify for Medicaid, which is funded by the government. So you still have a very, very large group of people that are uninsured, that are not taking care of themselves, and the only way that they can is running into the emergency room. And it's such a scary situation what we're living, unfortunately, but it's the reality. What's going to change it is us taking better habits, really taking care of ourselves, looking at ourselves and saying, what's going to change? What am I going to change about me? Even if it's one thing, what are we going to change?
Absolutely. And it starts from within.
Yes.
So if personally I try to impact my life or take better care of myself, positively, I would affect someone else,
Yes.
And before you know it, we'll have a better community, we'll have a better country, so people will be more mindful of health. So that's why I'm gonna bring the second question with the company, because I know that this company has done great stuff. They have great products, and I want you to talk about, first of all, about the company and the products they offer. Because I know some people are watching. They probably wonder, they see my skin beautiful. They see you beautiful. They wonder, what are we doing, right?
What are we doing? Well, that's what we're here for, to tell you what we're doing. Arbonne, how I ran into Arbonne was just God sent. I wanted to change something about me. I had a problem. And I know a lot of people have a problem. You have that problem too. We busy women with a lot of things to do in the morning. Rush, rush, rush. We get out of the house and we don't eat. Right? We don't eat breakfast. I wasn't eating breakfast ever. And if I did, I would pick a piece of bread and coffee. I call that breakfast, which is the two wrong things I shouldn't even be having. It didn't help me at all. It became addicting, the coffee, just to get that energy.
Throughout the day,
you know. And so here came Arbonne to the rescue. They have all range of products. Like I said, it was nutrition, health, and body. I'm going to read a little verbiage about the company because I want to be just as transparent as I can possibly be, because I want you all to understand the message. Arbonne is a holistic company. Their approach to beauty, health, and wellness, focusing on the person from inside out. We innovate using plant-based ingredients, grounded in science, clinical search with high standards for safety. We have high ethical standards. In Europe, over 1,600 ingredients are banned and growing. Arbonne abides by the stringent ingredient policy that has over 2,000 ingredients on our not allowed list. Most of the products are third-party tested and certification. We subject all our products to a scientific testing to continually raise our standards. The way we see it is, it's all connected. The health of one affects the health of another human being.
Correct.
It's something you just touched, right? That's what we called mind, body, and skin connection. Arbonne products are developed with the relationship with mind, a mind to foster the deep connection between your mind, body, and skin. Arbonne goes above the industry standards in testing both our raw materials and finished products, and few other key standards you can count on with our nutrition. And the following products are done this way. They're plant-powered, vegan formulated gluten-free, formulated with no GMO ingredients, formulated with without dairy, soy, nuts, common allergens, and artificial colors, flavors, or sweeteners. So that right along, I've never been vegan in my life, and I don't know if I could ever be vegan, but the thought that I can take a breakfast and know that I'm putting nothing but good stuff in my body. And that is so good for me. I'm not a dairy. I'm away from dairy because I think when we start listening to our bodies, we start noticing what are the things that affect us. And dairy is one of those things that I think we should take as a child and then we should wean off as adults because it just doesn't work out for some of us.
Absolutely.
And you know that. It just doesn't work for some of us. So that's how I came into Arbonne. That's who Arbonne is. I wanted something different. I needed to change. I was hunger to change the way I ate breakfast. So now I have a routine that I take, because rushing out and skipping a meal was really affecting my body altogether. And you know the importance of having breakfast.
Yes. And I remember when you came across the product, you were very excited after you've tried it, and you called me, said, Dr. Blanc, you got to try this. You got to try this. And this has affected my life too. But before I give my experience, I want you to tell me how it has affected your life.
Well, for me now, I have a routine because, like I said, I didn't eat breakfast. Another thing that I wanted to do is my water intake. I didn't drink water. I was raising my consciousness because I'm always reading and I'm always searching for stuff. I'm one of those people that just goes into things and I go really deep. So when my consciousness started being awakened, I started realizing, well, Christina, you don't drink enough water. You're not eating proper breakfast. Mm-hmm. What are you going to do? Because a lot of things in my body started going wrong after 2020. Mm-hmm. You know, I had COVID. I didn't feel good after that. A lot of things started happening in my body, and it was scary. It's scary for everyone who's had it. Not everybody's been fortunate to, you know, deal with it the way I deal with, but I wasn't well. So I started just trying all the products. I said, okay, I'm going to do something different. Whether it is walking 15 minutes a day, making sure I have 8 bottles of water a day. I want to detox my body. I want to take care of my gut. I want to increase my fiber because I knew that I was lacking all of that. And another big thing that some of us don't do, that I don't think any human being ever takes, the right amount of fruits and vegetables daily.
Vegetables, yes.
None of us do.
I know.
Because of the busy life that we live. And this is how Arbonne came into my life.
And sometimes we buy the vegetables and then they go rotten in our fridge.
Do.
You know, because we don't have the time, we live busy lives. But what good is that? We make the money, we live busy lives, we buy expensive stuff, but what good is that if you don't have health?
Exactly.
You know, health should be a priority.
It is, and that's when, again, the awareness of where we are in the present moment. Be honest with yourself.
Yeah.
Be there. Not in the past, not in the future. We are blessed to get up every day and breathe. Be thankful for the good and the bad. But we have the opportunity to fix us every single day.
Absolutely. I like what you said. Be honest with yourself. And I'm talking to the viewers. I'm sure there's someone, and I won't know the answers, but deep inside you know the answer. Is there anything that you should be doing for your health, but you simply are not doing anything? So everyone knows the answer.
Yes.
Everyone. Whether it's drinking water, whether it's exercising, whether it's eating the right food, have vitamin or supplements.
Yes.
We know what we need to do, but for some reason we don't.
We don't do it. Because
we don't do it.
We let our busy lives, which that's the new excuse. We're so busy. But in reality is, no, we're not. We have control of what we do. We have control of what we're doing in every step and everything that we're doing.
And if it's important to you, you will make the time.
Exactly.
You will make the time.
Exactly. We need to slow down. Slow down again.
Yeah.
Let's slow down a little bit. When we get up, let's not rush and get off the bed.
Yeah, let's breathe. Yes.
What a privilege is that?
I know, right?
How wonderful is that?
And just by breathing, it's just your mental clarity, your energy, you're able to focus.
Yes.
You can think straight and your day would be better.
Some of us get up and the first thing we do is grab our cell phones and go on social media. That shouldn't be our priority.
Yeah.
Our priority should be just getting up, being thankful, stretch, breathe, think about your day.
Meditation.
What is the first thing? Meditation, which is something that I do on a regular, constantly. We live in a world that is constantly throwing so many things at us. People
so much chaos,
body shaming, drama everywhere you turned around. All of that affects us.
Yeah.
If we don't take care of our circle, if we don't take care our energy, if we don't protect it, we're killing us because all of that turns into stress hormones, and stress hormones turn into major illnesses, which they end up being the chronic illnesses that we just talked about.
Yes, exactly.
So with Arbonne, what I've realized, which I'm going to share with you my top 5 products, because I can only speak on the things that I feel comfortable with. Again, I'm not a professional, so I will be reading a lot of the
But before
content.
you go into the 5, though, we will have to take a short break because I don't want you to rush. I want you to take your time because I know the top 5 are so important.
Yes.
And I want people to take note. And I know your information would be displayed on a screen so that if they want to reach out to you,
Yes.
so that they get the information.
Yes.
So we'll be right back after these quick messages.
Caring Hearts Family Medical Center, un établissement moderne qui dirigé par Dr. Jocelyne Blanc, Dr. Jemimez et Dr. Reginald Jérôme. Caring Hearts déjà fait un pile palais de lit dans Belle Glade à West Palm Beach. Clinique là équipée de plusieurs blocs opératoires ultramodernes avec des spécialistes professionnels qui d'ailleurs parlent anglais, créole et espagnol. Quand il s'agit de bail soins de santé, il y a pile l'autre clinique qui existe. Différence qui gagne, l'autre clinique qui travaille pour. Nous-mêmes dans Caring Hearts, nous prenons soin. Nous traitons chaque patient avec passion dans un cadre qui est propre et soigné. Caring Hearts prend plusieurs assurances médicales, telles que Humana, Medicaid, Medicare, Oscar, Wellcare et un pile l'autre encore. Caring Hearts Family Medical Center, c'est numéro 1 dans les affaires santé.
Welcome back. If you've just joined us, we are talking about Beyond Wellness. I have my co-host, Christina Jemimez, who has given us great information. But my next question for you, Christina, I know we've talked about it, but your 5 most. I know they have a lot of products,
Yes.
but what are your 5 favorites?
Okay, my 5 top products that I'm going to briefly go through it. If you, at the end of the show, you'll have my information, so you can, if you want to open to learn more about it, please reach out, text me, email me. I always answer my phone. Whatever is easiest for you, I'm here for you. I will answer any question, provide anything that I need to provide to you. So being that I had said in the beginning that there was things that I wanted to change. My water intake, eating breakfast was a number 1 thing I needed to do because you told me, and my other doctor was like, you need to eat breakfast. I was like, okay. So I said, I'm going to eat breakfast. The water intake, another thing that I was having was I have this thing with my kidneys and my liver that I always feel like it's something that you need to cleanse.
Detox,
and I keep hearing
yes.
so much about detox, but I didn't know that it was related to my kidneys and liver. I was only thinking like my blood needed to detox and not understanding what else it was. And so Arbonne opened my eyes to so many things. So then the 5 things that I'm going to talk about is going to be the protein shake, our gut probiotics fiber, gut health probiotic, which these are 2 different things, our greens, our superfoods, and I'm going to talk about our detox tea, which those are my 5 top ones.
So the energy one, how does that work for you?
The energy one. Oh, Dr. Blanc, this is my favorite drink of the day. I'm going to tell you guys, I used to be hooked on coffee. I did drink sodas. I'm not going to lie, because I did drink sodas. And I never been a really big person in juice, but then Starbucks came around and they have everything. And I was like, Starbucks is taking my money every day, but Arbonne took care of it. Arbonne took care of it. We have Energy Fizz, the Energy Fizz, which I'm jumping right into it. So let me look at my notes because I don't want to tell you guys anything different, which is my favorite drink of the day, along with some other stuff, guys. It's low calorie. It's a yummy drink. It promotes alertness. It reduces fatigue. They come in 3 different flavors: citrus, pomegranate, and strawberry. I'm sorry, did I miss one? Yeah, no, citrus, pomegranate, and strawberry. Strawberry is by far my favorite.
Your favorite.
Okay. The Arbonne solution to coffee is the fizz. And that's how they got people to stay away from this stuff. It has the low sugar, a blend of vitamins B, chromium. Am I pronouncing that right? Chromium. And it says chromium helps support the adrenal gland. These glands sit right on top of the kidneys and are in charge of so much, including blood sugar control, sleep-wake cycle, and stress response. Very low very low dosage of caffeine gives you a calm energy and no crash afterwards. And that is so, so true. It's so different from you having coffee. You know how you have coffee and then you just like, you go down? You never feel like this with the energy drinks.
Yeah.
They're not super sweet. You can do them in 8 ounces of water. You can add fruit to it. Today, my favorite was doing the cherry flavor. I cut up some strawberries, mixed those two together in my 16-ounce bottle, and I was in heaven.
So you have your water, you have your energy.
Right.
You have it all, yes.
And it's all plant-based. It's all made out of green tea. And I don't know if I'm saying this word right, guarana, which is what acai comes from. So you're getting nothing. It's not like drinking a Monster drink or those different energy drinks that were very high on sugar, caffeine and sugar, which is so dangerous for your heart. So that's one of them. Since you jumped right into it, my other one that is like, when I learned what our stomach does and how important it is for us to take probiotics and fiber, that's my other one. It's so important, especially like for people who take a lot of medication, how it tears up your stomach and also causes a problem that is now called leaky gut. I did not know what that.
And it kills the good bacteria.
And it kills the good bacteria. So since we don't eat enough food that produces those type of bacteria, we have to take probiotics, enzymes, and prebiotics. The one for Arbonne comes in a little box, 30-day supplies. It's best to take those probiotics first thing in the morning because you want to get your stomach going and ready to absorb your food, right? And all your vitamins and minerals. So that's one of my biggest, like I'll never stop taking that. Everybody should be taking some form of probiotics and enzymes and prebiotics. The next one that is my favorite is fiber. We do not eat enough food with fiber. We need to increase our intake in fiber because that's how we process our food.
And that's how it helps with regularity. A lot of people complain. I see it all the time. My patients come, they have a lot of complaints with constipation, something about their gut. But it's because they are not eating a lot of fibers. And when they tell you about their diets, it's full of carbohydrates, sugar, a lot of stuff that constipate them. But they don't eat a lot of fiber. So with this, it solves the problem.
It's phenomenal. I normally don't like to talk about other products, but I always regularly, because of heart health and cholesterol, that they tell you should always do fiber too, to lower your cholesterol and to keep you regular. And the other big risk factor is colon cancer. It's huge. We have to. It's mandatory that we do fiber. What I'm going to tell you, the difference between Metamucil and this fiber, when you do Metamucil, it thickens up so fast, and it's the most gross thing to swallow. I have to admit to it. I did it because I had to do it, not because I was having problems to go to the bathroom, but because I knew that it was something I needed to do for myself. The one from Arbonne is the best thing ever. It never thickens up. It's water. It's like you don't taste it. You can add it in sauces. You can add it in your soup. You can add it to your coffee if you're a coffee drinker.
You can add it to your shake.
You can add it to your shake. Anything. So taking fiber in the morning and at night is great. It works in the morning. It helps you throughout the day, and at night, throughout the night, while you're resting, it does what it's supposed to do. My other top one that I haven't talked about is the tea.
Super greens or the tea?
Oh my God, no, the super
greens.
Super greens. We don't take enough vegetables.
We don't.
It comes in a can of 30-day supplies. It's all greens. When you open it, you smell it. Right? It has a little slight taste but you smell a little bit of everything. I'm going to tell you, it's not nasty. There are some products out there that you're like, oh, I don't know if I can swallow this. You don't even taste it. I usually sometimes put it in. My cousin, her favorite drink in the morning is super drinks. She takes 8 ounces of water, the scoop of the super green, so she's having the right amount of vegetables and fruits. She even adds additional fruit. She says she adds pineapple and apple, green apple, she says, is in the fiber. And she goes, it is the best energized drink that you could ever drink. She goes, and what the wonders that it does for your body and your skin. She said, in 2 days, I saw a difference in my skin right away. Now, she's an esthetician, so she's learned every part of your body. Every time, if I bring her to your show, she's just, you want to hear her because
I would
she's
love
so
to
good.
have her then.
She's so good. So super greens can be added, but then now you're having the right amount of vegetables and fruits that we're supposed to have in a regular day. Now, the next one is the herbal detox tea for our liver and for our kidneys, which is also very important for us to have, which I skipped a note. Okay. This green tea is herbal. It's herbal like a regular tea. It has a slight taste of mint. I drink it cold or hot. I don't even add, before I add a little bit of honey, I drink it straight. I enjoy it so much. And what it does for me, you see it working right away. The first 2 weeks, my experience, because I was retaining a lot of water and I didn't understand what was causing it. And then again, I knew I wasn't drinking enough water too. So then that's probably why I had that retention. I kid you not, Dr. Blanc, the first week, I've never been to the bathroom so many times doing number one, because all that retention of water, how you see the impurities coming out of your body.
The toxins,
The toxins, it does it. And it's so important for people to know what is the function of the liver and the kidneys.
It's to detoxify, yes. And that's how they excrete toxins from our body, yes.
In our bloodstream, correct? So this is something important. The tea, you can take it 3 times a day. It's light enough where you can do it. It takes all the heavy metals out of your body. It's made out of dandelion and milk thistle, which are 2 very huge ingredients for it. We need our livers. Our liver needs to be, our kidneys filter our blood. So we need to take care of kidneys if we want to have a long life. Right? Yeah. These are all my 5 favorites. Not everybody's going to, I'm speaking for myself, what it has done for me. For everybody else, it's going to be different. Right? It just depends on you, on where your situation is. Everybody's body is different. Another thing that it did do for me was the increase, all of these products promote the increase of drinking water. Water becomes the main source for you. It's like, it's natural. It's natural because when you go into something and you say, I'm going to change, I'm going to give it a try, and you truly 100% give it a try without putting any buts in it, your body changes. Your brain changes. Your brain starts telling your body, this is good stuff. This is good stuff. I had yesterday, because I was too lazy to make my shake in the morning, Chick-fil-A. Why did I do it? Why? I was mad at myself. I did hit myself a couple of times, but I'm just playing. I was so angry because I didn't feel good. I did not feel good. I messed up my routine.
Your routine, yeah.
Your
body's not used to it.
My body was saying, Christina, what did you do? I was a hot mess yesterday. I was horrible. I was just lagging energy. And I was like, oh my God, why did you do this? You should just stop it and make it shake. It's not that difficult. And so the last thing that I'm going to talk to you about is the protein shakes. These protein shakes are not your usual. I've never taken protein shakes. This is the very first time I've ever have. I don't know. Have you?
I have, and I use it to work out now.
Right.
That's what I do. Okay. I do my shake in the morning and I work out.
All right. Yes. So being said with that, since you've taken protein shakes before, I don't have anything to compare it to because, like I said, I've never used protein shakes. I always thought that proteins was only for people who was doing exercises, trying to gain weight. That's how I viewed a protein shake.
We need proteins.
I didn't view it as something healthy. So the Feel Fit Pea protein shake is created with an easy-to-digest plant-based protein delivered from peas, rice, and cranberries. Okay, that's what this protein shake is made of. Adding the protein every day a simple part of your healthy living program. They're very delicious. They're not chalky. Also, there's a very important ingredient here, clinically tested and certified to have the lower glycemic index. Did I say that right? which means that the taste is great and won't cause a spike in your blood sugar, which is very important for those people who have diabetes that are concerned that they don't want to take certain products. The good thing with Arbonne, outside that is vegan, they have different types of shakes, even with like 1 gram of sugar in it. So it's accessible for anyone with any type of
chronic illness, especially diabetes.
Right. Again, I want to say this. The proteins are made with no whey, soy, or dairy. They're gluten-free. They're full of amino acids and vitamin B and minerals that our body needs. So when you mix this protein shake, you're actually having a full meal with all your vitamins, your minerals. I haven't had the need to take extra vitamins because I'm actually eating everything that I'm supposed to have to supplement my body correctly. And then turn around, you feel great. You wake up alert. You go to sleep early. Your body speaks to you, like I said, because I'm actually awake. I'm paying attention to myself and I'm investing in me. So then when I go see you, you always give me a good report and say, good job, Christina, you know, because I don't want diabetes. I want to take care of myself.
Absolutely.
And a lot of people view this, oh, that must be a weight loss program. No, it's not. It's not a weight loss program. It's a healthy living style, a sustainable living style, because I still eat everything regular. I eat it moderate. I am more conscious of what I'm putting in my body. And your body is going to speak to you because now you're fitting in such important stuff. It's like, hey, why are you eating that?
Yes. Whenever you feel something you know you're not supposed to, you feel it.
And I know you've been taking them because you want them to get more sexy, because we don't need you skinny, we need you more thick. So I know for you it's done wonders too, because you're always in the rush. Like in the mornings, our mornings are very hectic.
Yes. Absolutely. I know we don't have much time left. We have to have you back on the show, Christina.
Yes, I do.
There's so much to talk about. So I want your last words for the audience so that, just tell them how to reach you.
I can be reached. It's my cell phone. It's going to be listed in the bottom. I have my webpage for the Arbonne company that it goes right into it. But send me a text message. Call me. Email me. I will be accessible for you. If you're intrigued, if any of these products is something that you would like to learn more about, I will send you the information. This is for all ages. My fiance takes them, my kids take them, everybody in my household, my mom, my sister, everybody. It's a wonderful, wonderful thing. And again, it becomes alertness. We are creating a conscious change in our body that then it will turn around. It will be healthier for everybody around us. We want to live forever and as long as we can, so why not start now?
Thank you, Christina. Thank you for coming on the show.
Thank you for having me.
And thank you for sharing this great information with the audience.
Thank you.
I am proud of the work that we are doing as a community. We are, if we help each other, I think we will have a better community. So that's one of the reasons I love the work that we do at Caring Hearts, because we could have gotten this information. After I got the information from you, I could have said, okay, I'm happy with it. I didn't have to share it with the world, but we feel like we have an obligation to share it, to let it be known to other people so that they know what's good for them. So that's why Caring Hearts has been around for this past few years, 8 years to be exact, giving the right information, impacting people's life, and making a difference in your life. When we see you as a patient, we don't just see you. We see you, we see your family, we see your community. And that's why we are so proud of the work that we do. So Caring Hearts has 3 locations if you want to join us. We have one in Palm Springs, which is located at 2135 South Congress Avenue. And our phone number is 561-965-6333. We have another location at Belle Glade at 371 South Main Street, and another location at Port St. Lucie, 772-249-393. It's a new number, so that's why I don't know the numbers so well. So just to tell you, we are very involved in a community, especially the Haitian community, because we know the lack of education is there. And that's one of the reasons we promote education, we promote prevention, we promote health awareness, because we know if we do the right thing on time, guess what, Christina? All those things we talked about, all those costs, would be cut in half or even would be non-existent if we do what we are supposed to do. So at the end of the day, we want you to focus on your health. We want you to focus on yourself. And even if you do baby steps, when I say baby steps, if you do 20 minutes a day of exercise, you drink the right amount of water, the right amount of vegetables, the right amount of food, portion control, you'll make a difference in your life. And guess what? At the end of the day, you would be the winner because you would add more life, more years to your life, and you would be away from diseases or chronic illnesses. So until next time, take care of yourself, your family, and each other. Have a great night.
Caring Hearts Family Medical Center, un établissement moderne qui est dirigé par Dr. Jocelyne Blanc, Dr. Odiel Jean-Baptiste et Dr. Regina Jérôme. Caring Hearts déjà fait un pile palais de lit dans Belle Glade à West Palm Beach. Clinique là équipée de plusieurs blocs opératoires ultra modernes avec des spécialistes professionnels qui d'ailleurs parlent anglais, créole et espagnol. Quand il s'agit de bail soins de santé, il y a un pile l'autre clinique qui existait. Différence qui gagnait, l'autre clinique qui travaille pour. Nous-mêmes dans Caring Hearts, nous prenons soin. Nous traitons chaque patient avec passion dans un cadre qui est propre et soigné. Caring Hearts prend plusieurs assurances médicales, telles que Humana, Medicaid, Medicare, Oscar, Wellcare et un pile l'autre encore. Caring Hearts Family Medical Center, c'est numéro 1 dans les affaires santé.